The flight had been delayed by 4 hours, and somewhere over the middle of the country, the man in the window seat had gone very, very quiet. I noticed because he'd been anything but quiet before that. He'd been the kind of traveler who apologizes for his elbow, then uses your armrest anyway. He'd asked me twice if I thought the turbulence was bad, and I'd said no both times, which was true, and also the kind of reassurance that doesn't actually reassure anyone. His name was Marcus. I knew because he'd introduced himself when we boarded, which people almost never do anymore, and I'd thought it was either very old-fashioned or very anxious. Turned out it was both. When he went quiet, I looked over. His face had changed color in that specific way. Not pale exactly, more like the warmth had just drained out of it, the way a room feels after someone turns off a lamp. His jaw was tight. His breathing was shallow and a little fast. I said, quietly, "Hey, you doing okay over there?" He turned to look at me, and I could see the effort it took. "I think I'm fine," he said, which is almost always what people say right before they're not fine at all. I'm a nurse, have been for going on 6 years now, and before that, 2 years of school that felt like 10. I was flying home after a week visiting my sister, and I had my medical bag with me the way I always do when I travel. Not because I'm dramatic about it, just because things happen. Things happen at 35,000 feet just like they happen anywhere else, and I would rather be slightly over-prepared than be the person on the plane who keeps saying, "Is there a doctor on board?" into the empty air. I asked him if he'd eaten. He had not. I asked him if he'd had water. Also no. I asked him, more carefully, if he had a history of anything I should know about, and he gave me a look that was equal parts embarrassed and grateful, and said he was diabetic. Type 2. Managed, mostly. But he'd been rushing all morning, and he'd skipped breakfast, and then skipped lunch, and now here we were, somewhere over flat middle America, and his hands were starting to shake. Not dramatically, just that fine tremor, the kind you feel more than see, the kind that lives in the fingertips. I got his blood sugar with the little monitor I carry. It read low, not dangerously so, but low enough to explain everything. I gave him the juice from my bag and the crackers I'd bought in the terminal, and I watched him eat them with the focused attention of someone who is very carefully not making a fuss. He was maybe 40, a little rumpled in the way of men who travel too much for work and sleep too little. There was something quietly dignified about him, even when he was clearly uncomfortable, which I always find more moving than people who perform their distress. While we waited for his sugar to come up, he asked me what I did, and when I told him, he laughed, just a short, startled sound. "Of course," he said. "Of course you're a nurse." I asked him what that meant, and he said, "You have that thing, that calm thing, like nothing is going to be worse than you can handle." I told him that was mostly just a face I made, and he laughed again, and some of the color started coming back. By the time we landed, he was fine, really fine, not airplane fine. But when we were walking through the terminal, he stopped and turned to me and said he had a prescription he'd been putting off filling, something his doctor had written 3 weeks ago, something injectable, and he was, he admitted, a little afraid of it. I said, "Tell me about it over coffee," which is not something I usually say to strangers in airports. But there was something about Marcus, the shaking hands, the quiet dignity, the way he'd said, "You have that calm thing," that made me want to see this through. We found a corner table in one of those airport cafes that are trying very hard to feel like they're not in an airport. He pulled out the prescription, slightly crumpled, and I smoothed it on the table and read it. It was a weekly injectable, a GLP-1 receptor agonist, the kind that's become very common now for blood sugar management. His doctor had gone over it with him, he said, but then the appointment had run long and he'd been late for something and he'd just not retained any of it. The pharmacist had given him a pamphlet. He had not read the pamphlet. I told him that was okay. That's what I was here for. First things first. This was a subcutaneous injection, which means it goes into the fatty tissue just under the skin, not into the muscle. That distinction matters more than people realize. Subcutaneous injections are gentler, slower to absorb, and this is the part people are always relieved to hear, much less painful than intramuscular ones when done right. The needle is short. The angle is shallow. The whole thing, when you know what you're doing, takes about 10 seconds. The most common sites are the abdomen, a couple of inches away from the navel, the outer thigh, or the back of the upper arm. He'd be doing this himself, so the abdomen or thigh would be easiest. I told him to rotate sites, never use the same spot twice in a row, because repeated injections in one place can cause the tissue to harden over time, and then the medication doesn't absorb properly. He was listening the way people listen when they're trying to memorize something they're also a little afraid of. I said, the thing that makes people nervous is the anticipation. The needle going in is almost nothing. What hurts is tensing up beforehand, or going too slow because you're hesitating. He said, so just go fast? I said, confident, not fast, confident. There's a difference. Fast is panic. Confident is just knowing what you're doing and doing it. I walked him through the steps. Clean the site with an alcohol swab. Let it dry, which people skip and shouldn't because the alcohol sting is worse on wet skin. Pinch up the skin lightly if you're lean to lift the fat away from the muscle beneath. Insert the needle at a 90-degree angle for most people, or 75 degrees if you're very slender. Push the plunger slowly and steadily, not a rush, just a smooth, even pressure. Hold for a few seconds after. Then withdraw straight out, don't angle it, and press gently with a clean swab. No rubbing. Rubbing spreads the medication unevenly and can cause irritation. He repeated it back to me, almost exactly right. I told him something else, too, because it matters and his doctor might not have said it directly. With this class of medication, nausea is common in the first few weeks, especially if he ate a large meal right before or after the injection. Smaller meals, slower eating, more water, not because the medication is dangerous, just because his body was going to be adjusting to something new, and giving it a little grace made the whole process easier. He wrote that down on the back of the prescription envelope. His handwriting was neat, careful, the handwriting of someone who takes notes seriously. Outside the cafe, we were going different directions. He had a connection, I had a car waiting. He held out his hand and I shook it, and he held it for just a beat longer than a handshake usually lasts. Not strange, just present. The way people are when something has shifted slightly between them, and they're acknowledging it without naming it. He said, I'm going to fill the prescription tonight. I said, good. He said, thank you for all of it. The juice and the crackers and he gestured vaguely, the whole thing. I said, you would have been fine. He said, maybe, but it's nicer this way. And I thought about that on the drive home, the way he'd said it. It's nicer this way. Not better, not safer, nicer. Like the whole point wasn't just the outcome, but the company you kept on the way there. I think that's the thing about this work that I never get tired of. It's not the procedures. It's not even the knowledge, though I love the knowledge. It's the moment when someone who is afraid stops being afraid, and you were the one standing there when it happened. You were the one who said, I've got you. Just breathe. This is going to be fine. And then it is. That's enough. That's always been enough for me.